connected. Okay, and we are live. Welcome to the Addiction 911 show. We're just waiting for another guest right now who's getting on her computer. And we're so excited to be here today. And she should be in a minute. We'll just start a little bit with what we're going to do today. What we're going to do is, for all of you watching out there, is we're going to pull some headlines about addiction from the news. What's really important for you to know right now to help either yourself or your loved one or anyone you know who's dealing with addiction. These are topics right now that are in the news that are very relevant, and we want to have all our experts and panelists give their opinion and their expertise. And you can also, in the comments, if you have any questions for any of the panelists, please feel free to write them in the comments. I'm going to check on my phone here as we go. Let's see, we can see that we're live here. And my name is Christina Rowe, and I'm the host of the Addiction 911 show and founder of the Addiction 911 magazine. Okay, we're on live. I see that we're live. Let me just mute myself here, though I could just see your comments. Good. Okay, perfect. Okay, so I'm going to start now. Just going through. We'll wait for Karrol to get back on, but we'll start with let's start with Dale. And each of you, I'm going to say your name. Just tell us about what you do and how you help in the addiction community. So Dale Redlich is from NCRCPay to Patient. Is that correct? And
Well,
I probably said it wrong.
well, the name of the company is Pay to Patient, LLC.
Oh, okay. I think I took your letters and I combined it when I copied it into my paper. Sorry about that. So Pay to Patient. Tell us, Dale, all about yourself and what you do in the addiction field.
Well, I've been in the addiction field for probably a bit over 30 years. I, at one time, founded and owned a full-service treatment center called Challenges, which I ran for about 18 years until I sold it about 4 years ago, and ultimately started this company called Pay to Patient, which is a specialized healthcare boutique collection agency. And we work with treatment centers, detoxes, billing companies, labs, hospitals, chiropractic groups, physician groups, etc., collecting money that's owed to them from various sources, such as copays, deductibles, self-pay fees, which haven't been fully paid. And there's also a collection area whereby the carrier is paying the client directly for the treatment services rather than paying the treatment center. And we locate and retrieve those checks and turn them over to the treatment center or the hospital group, whichever it is. This is more in keeping with a revenue management type of service. So
Great.
that's basically what we do, is being a full service collection agency for healthcare.
Great. Well, thank you, Dale. Well, I'm going to move over to Robert now, Robert Cantrell. And Robert, just tell us all about yourself and your company and what you do in the addiction field.
Great, thank you. I'm Rob Cantrell. I formerly with Hazelton Betty Ford in Rancho Mirage, California. I'm now living in South Beach, Miami, and we'll be working with the Impact program starting August 1st, which is an organization that focuses on children that are already in the system through juvenile justice. My passion is working with the LGBT community and especially the crystal meth epidemic.
Thank you so much, Robert. So let's move over to Beverly now. Beverly, tell us all about yourself and what you do in the addiction field.
Hi, I'm Bev. Can you hear me?
Yes.
Oh, great. Hi, I'm Bev Buncher, formerly from South Florida. I currently live in Houston, Texas, and I am the owner founder and owner of the Be a Loving Mirror program for family recovery. I have the BALM Institute, which is an international family recovery education and life coach training program. And we serve families all over the world by training phenomenally expert life coaches specializing in family recovery. We are the first family recovery life coach training program to be accredited, fully accredited through the International Coach Federation. In fact, we're the first recovery-related life coach training program to be fully accredited. I've been doing 10 years, and the culmination of my efforts so far has been in this book, BALM, The Loving Path to Family Recovery, which has been out for the past 3 or 4 months. And I'm currently at the Opioid Summit in Houston sharing this book in a place where there is a tremendous peer support network. And I just want to say that the work we do is not peer support. It is professional life coaching and family recovery education taught by experts in the field. We would love to have people in the field who want their message to get across to families to come on our program, which is on twice a week for our community. We have a large community of families that we for a full year for a comprehensive program where we're sitting in a room like this and we have experts, we have family members, we have loved ones, and we learn about everything that it takes to get your life back as a family member and help your loved one get theirs back. We have a loving approach to family recovery. We're all about love and connection. We have 12 principles, 7 steps, lots of support, and a powerful, loving community.
Wonderful. Thank you so much, Bev. That's fantastic. Congratulations on the book. So,
Thank
Dr.
you.
Sunny, you were from Lumiere, right? Am I saying, is that correct?
I'm actually from Miami.
Oh, okay. You're from the, what company are you from? You're filling in for
Gables Counseling Center.
Oh, okay. Okay. I have Annie's information here. Okay.
Yes.
So tell us all about yourself, Dr. Sunny.
Awesome. I'm actually from California, but I've been in Miami for about 10 years. I've been in the substance abuse field for 10 years, done clinical work. I'm currently a clinical director at Changes Treatment Center, but mainly full-time, working as a private practice at Karrol-Gables Counseling Center. My passion is, along with Robert, the LGBTQT culture, along with children on the spectrum. But currently, I've been focusing on a lot with individuals. I see a lot of individuals have been coming in. Alcohol has been the presenting problem lately in couples. When they seek for couples counseling, a lot of times there's alcohol that's going on. I know, opiates is an epidemic, but for some reason, I've been noticing a lot of alcohol use lately. And for some reason, it's just been correlation I've noticed with domestic violence as well, which is obviously so common as we are familiar with that. So alcohol and domestic violence has been the presenting problem for me lately in the past several weeks.
Wow. Okay. Well, thank you so much for sharing. So let's just dive in. The biggest headline right now in addiction right now is singer Demi Lavato. I'm sure you've all heard of her, and she overdosed, and she had to be revived with a Narcan. We don't know what substance. There was rumors that it was heroin, but we don't know. What makes this unusual is not unusual because it is usual in the addiction field, but many people who are not familiar with addiction would say, she was clean for 6 years, sober for 6 years. Mm-hmm. She was like a role model to young women. She went out, for 6 years. She had done her year in detox. So it was a huge, sadness, and thank God she's alive, number one. But the fact that after 6 years, she relapsed. So this is bringing up, a big point of why drug addiction relapse is not just common, but likely. And that headline was from prevention.com about this situation. So let's talk about that, because there's a lot of families and friends and relatives who just don't understand, people 10 years, 20 years, 5 years, a year sober, and then relapsing. It's like, it's really hard for them to understand how this can happen. And why this is more likely to happen than not. So we'll start again with Dale, and we'll go around. And what is your thoughts on this?
Well, of course, addiction is an insidious disease and affects millions of people across the country. They say that relapse is part of the disease. I'm not sure if that's true or not, but I do know that we see more relapses with people that have a certain celebrity status who may not be following a treatment plan or a recovery plan that is working for them. There's some tendency that I've observed that people sometimes drift away from the recovery plan that's been working very well for them, and we don't know what the reason is necessarily for that. Perhaps the clinicians here on the panel would be able to answer that better than I, but I don't think that the circumstances of what happened to Ms. Lavato is unusual in any way, given the drug of choice and the pressures that are put to bear on celebrities in general, addicts in particular. But I think that there is a lot of pressure on celebrities to maintain a program, to show up where they're known, and to be a role model. It may be the role model component that puts a lot of the pressure on. And since we don't know exactly what happened or why it happened, it's a little difficult at this point to try to speculate. But
Right,
it's unfortunate, and we're happy that she made it through alive.
Absolutely. And it's not, like you said, it's a celebrities have pressure, but this happens. I think people don't realize how many average, normal, regular people relapse. And it's really shocking to family members and friends and people just wondering, like, how could this happen again to somebody who was clean for so long? So, Robert, what are your thoughts? Thank you, Dale. What are your thoughts?
Well, I was listening to her new song that was released 2 months ago called Sober, where she makes a statement, Mama, I'm sorry, I'm not sober anymore. And that was almost like a proclamation, which is sad in itself. But she's a role model for sobriety, but she's got to be a role model for herself. And the public and people around her must know we're not cured from this disease. Like diabetes, we can keep it under control. We can keep it under wraps. The only thing that, to me or any of us, have in our power is the first one. And past that, the disease takes over. And once again, that's what happened to her. Thank God, as everyone else has said, that she was able to get Narcan and she was able to get back to the hospital. It takes a lot more understanding than what I think the public has right now. Someone posted on my Facebook page yesterday, well, she's clean for 6 years. Why didn't she just smoke weed? Well, that's not a solution. Get to the core of the problem. The core of the problem with any addiction is always pain. And
yes,
pain is what brings us back.
And that's a really good point that you bring up, Robert, is that it's the people who are not addicts don't understand. It's very difficult for us to understand. I mean, before I started working with all of you and learning so much more about it, I too was like, well, why, you just don't understand until you really meet people and start to understand and get educated. And that's what this type of show is important. So people understand that it's not that easy. It's not just, okay, switch to something else, or, you should have more willpower, or, people just, it's, unless I guess you truly have gone through it, you don't understand it. And I think we have to, definitely be sympathetic to that. So Beverly, what are your thoughts about, the situation with relapsing and how this will affect maybe teens who are looked up to Demi, and maybe now they're going to say, oh, well, you know what, I don't need to stay clean anymore, or, what do you think?
Well, I would think it would be the opposite, She relapsed and overdosed, and she was fortunate to stay alive. An overdose is much more common on the tail of a relapse, because when the body has been clean and then starts using again, it's a shock to the system. The other thing too is that we teach our families about the stages of change, that it's not just getting clean that is the answer. It's really making a decision, going from, I don't know if I want to do this, to maybe yes, maybe no, to preparing, to actually taking the action, and then sticking with it, the maintenance phase, keeping with your recovery program and all of the other things that you need to do. And families too go through these stages of change. And families are a critical piece in a loved one's recurrence or staying clean. We don't cause our loved one to lose their sobriety or keep it, but we contribute greatly to that process.
We might have lost you. Can you hear me, everyone, or is it just Beverly frozen?
Yes.
I can hear you.
It isn't a surprise in a song, but rather it's seeing it coming, and that's no judgment of Demi's mom. It's just all of us. It's so easy to be in denial, to see, I don't see it, I don't hear it, to listen to the lies. It's important for families to believe their eyes and their ears and not the lies their troubled loved ones are saying to them. If you see that something doesn't seem right, jot it down. Just keep a documentation of the things that aren't quite right with your loved one. And in a loving, quiet place, let them know the facts. You may make a difference in their life, may save their life.
Great advice. And families who are watching this and friends, that is I used to own a hair and nail salon, and I was blind to the addicts that worked for me. I didn't see it. And until after I sold the salon, one of the workers was arrested for crystal meth, and he went to jail for a couple of years. It saved his life. And I'm like, he was on crystal meth. I didn't even know that. How did I not know that? I work with him every day. I didn't
think back on it, Christina. Were there any little signs?
Yes. Well, first of all, he was obsessed with sugar. He would drink like tons of soda a day. He was erratic. He would fly off the handle. He would get like boxes in from like the FedEx at the salon, and like from California. It was New Jersey at the time. But I just didn't put anything together. And it wasn't only him. There was several addicts in there. And I was just like, I had no idea until, back then. And I'm like, what? They're all, because that industry, beauty industry is a big.
Don't feel bad about it. Don't feel bad
about
it.
No, I don't.
This is what happens. Denial is the glue of the addictive system. So what we're doing is helping families see through that denial so that they can be a force for good and for recovery in their life.
That is fantastic, Beverly. That is great. And Dr. Sunny, weigh in on all of this.
Yeah, well, actually, just hearing the news really hit it hard for me, just because not too long ago I lost a client of mine to addiction. I work with this. I did my dissertation with the Seminole Tribe of Florida with the indigenous people, so I've seen addiction on so many levels. And as I, heard the story about Demi, and then I decided to just play the song several times just to kind of hear what she was crying out for. There was a lot of emotional pain there, obviously. We have to keep in mind and be mindful that it's addiction, but addiction just doesn't happen. There's factors that leads to addiction. For instance, Demi, for me, was more so crying out for help. There was a mental health status there that was taking place, a lot of sadness, sorrow, loneliness. She constantly talks about, I'm lonely, so I go to this drug of choice, whatever that drug of choice is, to pretty much numb herself. And a lot of times addiction is, sometimes it doesn't even have to do with loneliness. Sometimes individuals don't even want to feel happiness. They don't want to feel anything, so they numb themselves because that's also uncomfortable. For me, it's more so seeing so many young individuals pass away within the tribe, and besides outside of the tribe, I see so many individuals relapsing, overdosing, and there's resources out there. And I know a lot of people say there's not much resources out there, but there are resources out there. There are treatment centers. There's so many professionals out there that are constantly available to assist, but it has to take a lot of the systemic approach. As you mentioned, Beverly, is very important when it comes to the family dynamics, is educating those individuals. If it's not Al-Anon, what are some other smart recovery groups? What are some other groups that maybe the family can gravitate towards or take the initiative sometimes. And, as I've noticed the theme, BALM, I'm going to check that out. I noticed the theme of our conversation is denial. And it's not so much the addict that's in denial, it's so much the family members or the loved ones, whoever's interacting, the support system is in denial. It's okay, we don't want to notice those indicators, the red flags. That's actually, the addict is craving for boundaries, craving for help, but subconsciously they relapsed already. And I think when the family system doesn't notice what's going on, they're in denial. So unfortunately, sometimes they fit into the addiction. So for me, I think it's going to be very important, as I posted something with Demi, and it was more about, finding that inner peace, whatever that is. And it doesn't have to be the 12th step. It doesn't have to be smart recovery. It can be all of it. It can be meditation, yoga, church, exercising, whatever you make that program of recovery. We can't do a cookie cutter for everyone, because we're very unique, we're very different. So if we have the same program of recovery for every individual, it's not going to work. We come from different backgrounds, we come from different cultures, different upbringing. So I think we have to make it very unique as professionals as well, to be creative, but not only be creative with the individual, but with the family system as well. So my final thought would be is just for us to educate, also teach, or even express, self-love, self-compassion, to find that inner peace. And hopefully, the more awareness we have, hopefully we can reduce the amount of relapse. But I think we can't just leave it up to the individual. It has to be a whole systemic approach, and it doesn't stop at the family. It goes beyond that. It goes beyond us, the professionals. It's the whole society. Just like we have social media influencing other factors, we need to also have positive factors influencing society, and focusing more on the positive, focusing more on recovery than relapse. But if relapse is happening, what's so different with this relapse that was different from the previous? Trying to learn and educate and not run from it as well.
That's excellent advice, Dr. Sunny. And this brings up a point. We're talking about, the public and family members and friends of being in denial. The other side of this is that a lot of times the denial comes because not knowing what to do. If you have health insurance, then you can get partly into treatment, but there is a large majority of people who do not have health insurance. And on our last show, it was brought up to me that here in Palm Beach County, specifically Delaware, there's very limited resources. There's for people who do not have health insurance, that there's a wait list. I know there's something new that was coming out that was mentioned. There's a new number that you can call. Is anybody familiar with that to get help? I forgot exactly what number it was. There's some new thing coming out in Palm Beach County, but this is going on across the country. So it's easy for us to say, okay, just get your loved one help. But when the reality hits, and we get comments all the time from mothers on this show and family members, my daughter, my son, we don't have health insurance. They don't have the insurance, and it's, $20,000 a month or $30,000 a month. I mean, I know there's scholarships, but if you don't know about that and you don't know somebody, it makes it really difficult. So let's just quickly go around. Anybody have, I'll just let you chime in. Anybody have any advice? If someone's watching this, no matter whether they're in Florida, California, Texas, and their loved one does not have health insurance, what do you suggest that they do? What's the best way to get that person help?
Well, I can only speak for Broward County, but again, having served on the board of directors of BARC, which is the Broward Addiction Rehab Center, that is a place that provides absolutely excellent care through every level of care, from detox through outpatient treatment at no cost if you are a resident of Broward County. Unfortunately, I can't speak to Palm Beach County. I don't know about all the resources there, but I would imagine there are some. And it's a question of just locating some that would be willing to provide care, provide a scholarship if necessary.
Yeah, the problem is there's not enough of beds available, I think. That's the problem, probably even in Broward. Like, there's just waiting lists, and then people cannot wait, so that's the problem.
One of
You're
the
right,
big
Christina.
No, go ahead, Beverly.
One of the big problems is there are beds, but they're not designated Medicaid or no insurance or whatever. There are beds, and people are not getting them because we do not have treatment on demand. This is our biggest need in this country. Someone at this Houston Opioid Summit that I'm at today just said the most amazing thing. You know, we lost 65,000 people to the opioid epidemic this year. If 65,000 people this year had died in plane crashes, would we be twiddling our thumbs? We'd be figuring it out. This has been growing. They're expecting 77,000 to die in the next set of yearly statistics. That was the 16. I mean, it's horrible. And here in Texas, they're really working on it, but they're not there yet. And I think states are starting to wake up, but treatment on demand must happen everywhere for everyone.
Excellent.
Well, I think we're a country that's being held hostage by the insurance industry, and I've seen it when I've worked with inpatients, clients that were nowhere near ready to be released, where the insurance runs out. They're on the second day of a Suboxone taper, and they're gone because there is no funding. If a family member contacted me and wanted to know what means to go about finding a place, I would say do what we do with everything else. Google it. Google free counseling. Google free care. Google, get online and take a proactive stand. And what's important is to educate the families and let them know, just because a treatment center has a wonderful website, it does not mean that you're getting anything in return. It could be, I've seen some fantastic websites, and then when you look at the programs, you're going, oh my Lord, it's nothing more than a glorified big book study. That doesn't work for everyone. And I think what the doctor said is vitally important. There is no one size fits all. These people, including me, have a size 10 addiction. They need a size 10 recovery plan. And like Beverly said, we've got to move forward and be proactive in this country. And as professionals, we've got to lead the way.
And you bring up a really good point. That's one of the reasons we do this show. And the reason is with this Googling business, okay? You go on Google, you get all these fancy ads from people paying a lot of money per click that not necessarily are legitimate. We have some bad actors in this industry, in the addiction field. And so a mother faced with that, doesn't know who to trust, where to go. And that's why we do the show, because you are all here, legitimate, good people who they can turn to. That's why I would ask you all to put in the comments too, any resources you have, your phone numbers, your email addresses, so somebody can reach out for you who's watching the show, because that's why we want to provide the best to the viewers here, because it's very daunting to go on Google and you put in free thing and a million different things come up and those little ads come up. That's one of their keywords, and then it's not really free. So I think, and what Beverly said too, it's a shame with the amount, like you said, the insurance companies are to blame, the government is to blame. They've allotted all this money. Where is it? Why aren't there commercials running? Why aren't there through social media campaigns? Why aren't they running ads on saying, here's help for this state, here, call this number to get your loved one help? And we don't see that, and so I think it's up to us, everyone in the addiction field, to try to do that as much as possible, is to provide and try to post, a couple times a week, just a resource, for a free resource, like Dale, you said, Bark, post the number. Somebody may see it and may save a life, to help these, because people feel powerless, like a family, that's when they do put the blinders on, because they don't know what to do. Right. They don't know how to help. So they're like, I can't, deal with it. And so I think that's a responsibility of everyone in the field to do that, to get the word out, so that there are scholarships. Most people don't know that there's scholarships. I mean, the majority of people, if you were to interview them on the street, they'd have no idea that treatment centers actually offer scholarship programs, unless you're in the know. Right.
Absolutely.
Yes.
I think it's, you make a great point. Everyone does. And I agree with you, Christina, just getting the word out, whether it's every weekly basis, kind of having like a Yelp for addiction. Here are the places, the good reviews, the bad reviews. Coincidentally, I was watching The Greed yesterday, American Greed, on Kenny Chapman. And it was, it's so sad to see some of these treatment centers, they actually but they even end up harming the client. So it's like, yes, we have to be very careful where we're sending our clients to as well. And it doesn't just start with treatment. Treatment is just the first stepping stone, the foundation to get them grounded. What happens after treatment? You know, the recovery plan, what is the aftermath plan? So we just need a combination of things, because in reality, sometimes treatment is admission and discharge, the 2-week program and meetings, but what's more than that? You know, as you mentioned, Dale, as well, BARC. I've heard really good things about BARC as well, you know, referred a lot of clients to as well. But I think overall, as a foundation, we need more resources when it does come to those individuals who can't afford treatment. And addiction doesn't discriminate. And why should treatment discriminate?
Mm-hmm. That's a really...
Government moves very slowly. I will say, as far as BARC is concerned, that it took 18 years for them to build a new detox that only has a capacity of 45 beds. So when we're dealing with government and politics, then we're facing a very similar problem across the country. And this is not only in the addiction world.
Absolutely.
We don't have free health care either, in general. And so when it comes to any type of problem, either in the addiction field or the medical field, it is a major challenge to find the financing and the provider that's willing to treat somebody, especially if there are no resources.
That is a great point. And I think that this brings up that, okay, this is, government is slow, 18 years, 45 beds. I mean, come on. But guess what? Beverly said there's going to be an estimate of 77,000 people. If you're watching this right now, 77, that's worse than, it's a war of Americans will die this year. So we should all wake up, whether you're an addict, not an addict, a friend of an addict, and we should go and petition the government and put pressure on them to provide more free services for addiction. They've allotted money, President Trump, and so they did all this stuff, but it's still, we don't see it. They've got to cut the red tape, and they've got to do it now. And I think the only way they'll do it is if actually everyone, what if millions of people started calling in and started tweeting and started putting pressure? We don't want to see, almost 100,000 people die this year. Let's, provide more free resources. So something to
remember that there is still somewhat of a stigma attached to drug addiction.
Right.
And in general, the population who votes funding oftentimes does not want to provide help for people that they see as lacking in willpower and who have a fault for their continued use and relapse with drug addiction, which is different than when someone has a heart condition or diabetes or something that requires medical care, and it's considered to be something that they have no control over. The general public thinks very often that people do have control over their addiction, and it's their fault if they relapse and overdose.
They blame the addict, and it's easy to do because we call it a disease, but a lot of people will feel that it's something that they're choosing.
Yes.
So, on the flip side of this, and I think I sound like I'm echoing. Can you hear me echoing?
Yes.
Yeah, I don't know how that happened all of a sudden. Let me try to pull out. Is that any better, or am I still echoing?
Echo.
Still echoing. Let me see if I plug this back. Okay, hopefully that'll work. But I wanted to flip over to the reverse side of this, which would be pain management. Now we've got people, this is more resentment for the addicts, is that, I don't know why this happened all of a sudden with the feedback, but chronic pain sufferers are being denied medication because of addiction, because of the less emergency rooms are getting. So let's start with Robert. What is your opinion on that?
Well, I have to tell you, I think that it's a valid field. Chronic pain is chronic pain. And I'm echoing too, it sounds like. But I mean, there has to be alternative methods. Opiate usage can't be the only source of help. There has to be cognitive behavioral therapies offered, physical therapies. There's things that can that are available. You know, how many people were told that OxyContin was non-addictive? Now look where we are.
Absolutely. Thank you. So Beverly, hopefully you're not echoing like I am.
Hi. Am I echoing? Yeah, we're all echoing.
I think we're all echoing, and I don't know why.
Sunny, how
Sorry,
about you?
everyone.
Are you echoing?
I think I'm echoing probably as well.
No, you're not.
You're the only one not
You're
echoing.
the only one not.
It must be the MacBook.
Yeah. Something with the connection. So we'll just push through. So Beverly, tell us your thoughts on this. I mean, you know, it's really hard for someone who is, you know, suffering chronic pain, you know, and they go to an emergency room and they're looked at as a drug addict when they're not an addict. So then they resent addicts even more. So what is
So our focus on using opioids to deal with chronic pain was engineered by Big Pharma. Let's be.
She's right.
I think she
Rid of your
froze.
pain. Pain is part of life. It's part of what we go through. And are we losing our connection? And
We can hear you.
Can you guys still hear me?
Yes.
Yes, we can still hear you.
And the fact of the matter is that there are a lot of other ways to deal with pain and with chronic pain. Most opioid addicts did not start out as addicts, but did start because a doctor gave them a pain medication. Children, 17-year-olds, getting their wisdom, having a sports injury. This has got to stop. And chronic pain, it's very difficult. There are cutting-edge pain management clinics now that are slowly weaning all of their clients off and finding that they're having serious withdrawal as they move them into non-addictive pain management. But this is the way. This is the wave. And we've been on the wrong path, and we have to get back on the correct path. I know people don't want to hear this.
But is there a balance? I mean, if you were to go to the emergency room, let's say you're not a chronic pain, and you're in a lot of pain, and there's been in the news stories of actual ERs who don't have access to fentanyl or to morphine because of this, and your loved one is withering in pain, should they not get that? I mean,
that is a very good question. Let's look at the other side. If you have ever worked with families of loved ones who are addicted, and I cannot tell you how many moms and wives have gone to the hospital with their child or spouse for the flu, for something diabetes related, for whatever. And the first thing, boom, morphine drip. Hello. And we instruct our families, accompany your loved one. And when the hospital starts to come in with that morphine drip, no, it's no.
I don't see that happening though as much anymore because to be honest, like I get chronic migraines. Okay, so I can't take any pain medicine. It makes me throw up. So I have to take like, you know, the triptans and stuff that are not, you know, things like that. But I'm in a migraine support group, and there's a lot of migraine sufferers who are going to the ER and actually being looked at as drug addicts and being discriminated against because they need something more. Their pain is just excruciating. Like there's times when nothing works and you have to go to the ER. So that is what so this is, I think the balance, what you're saying, Beverly, is that, yeah, the doctors need to be educated. They cannot be giving morphine for the flu or for something minor, but they have to be compassionate.
The doctors, the nurses.
Yeah.
We are still owned by Big Pharma.
You're absolutely right.
This must end.
I think Beverly's right.
To the wind, but it's the truth.
I think Beverly's right. I agree with you. I agree with you. But I also think that if a person has had breakthrough pain that would require them to go to an ER, there are times when clearly an opioid is necessary. There's nothing that no cognitive behavioral therapy is going to relieve a third degree burn. These are simply things that happen. But as far as chronic pain on a long-term basis, that's where alternatives have to come in.
Absolutely. I agree with that. Actually, my ex-husband almost died because he had 4 herniated discs, and they put him on oxycodone, I guess it was, for years, and Xanax. And one day my son barely found him alive. He was in a coma for 2 weeks, and he was only in his 40s at the time, a couple of years ago. So thankfully now he's off of it. He still has chronic pain, but now he's on medical marijuana to control it. And he's able to deal without being on it. So there was an alternative. So yeah, exactly. Shouldn't start chronic pain sufferers, but yet we do have to be compassionate to people who are really, like you said, a third degree burn in severe, terrible, excruciating pain that now they're being looked at as an addict. And now that's going to make them more angry toward addicts. Like, I'm not an addict and I can't. And the doctors do look at you, even in the regular doctor's office setting, even for people who have anxiety, who want Xanax, they're looking at you like very suspiciously. There's a stigma now against people who aren't addicts, and that's making them more angry toward the addicts. So Dr. Sunny, what's your opinion on
The problem is that the opioids and the benzos are creating addicts. So we've got to find alternatives.
Right.
I think, as you guys all agreed on, the big guy is definitely controlling the entire aspect of pills and all sorts of things. But I think I'm not sure if we could go against that because it's always going to be there. So we need other alternatives in this case. So I think the first thing is also educate doctors as well, not just substance abuse experts, because I have clients who actually get Xanax from their PA. Or their primary doctor. They'll go in, they'll say, I have anxiety, and the first thing the doctor prescribes is Xanax. And they'll come to me and I'll say, was this a doctor or a psychiatrist? And honestly, 9 out of 10, I already know it's just a primary doctor and not the psychiatrist, because I know a lot of psychiatrists are very self-aware, are very sensitive to what's going on in the community of the addiction world. But I also think with just individuals, we can't also be closed-minded when it comes to chronic pain, because those individuals are suffering and they do depend on something to help them feel better, to cope with life. And because of the epidemic, they're getting discriminated. So I think it's bigger than the pharmaceutical companies. I think it's the knowledge that could happen and should happen within the medical field and the mental health field, so that every individual that is suffering with a specific issue is getting treated appropriately and not too much. Because even with the pain, the pain management clinics that's obviously getting micromanaged lately is also, why are you prescribing 120 pills to an individual when you should just give 30 pills? And if this individual is constantly coming back, hello, red flags. But we forget that a lot of individuals, and unfortunately in the medical field too, the greed plays a huge role. So there's doctors who want to make more money, and we have to be realistic. Not everyone's going to do the right thing, but I think having that knowledge and information out there, not only to the family members, but to the professionals, is going to be significant, because we're always going to battle against the pharmaceutical companies. And unfortunately, I'm not sure if we could beat them, but I think we could come in terms of finding a balance so that they're open-minded and so are we, so we can work together where they continue to maintain their business and we continue to save lives.
I'm personally not of a mind to blame pharmaceutical companies. They have developed the most incredible medications over the years that have saved so many lives and have made so many lives better. We have a tendency, I think, in this country to look at certain things from an all or nothing approach. Either it's not good at all for anyone, or it's too good and it's creating addiction. I don't see the pharmaceutical industry as having created products for the purpose of creating addiction. There is a legitimate reason for prescribing certain types of medication, which can cause addiction under some circumstances. We happen to be dealing with an elevated number of overdoses at the present time, but we've had problems in the past with other types of drugs. We had the crack epidemic of the 70s, and we've had other types of problems with other drugs. And even the marijuana that's being produced now and sold legally in some states like Colorado is light years more powerful than it was 20 years ago. And we're seeing a lot of car accidents and different types of behavioral problems from the marijuana that's even being produced right now. So I think I'm looking for balance because there is a legitimate need in some cases, but in other cases, it's purely for the addictive personality that's begging for certain medication. And I don't know how we're going to find that balance, but I think we have to take an approach which takes into consideration the needs of many people and not just a few.
That's a good point. I mean, and this brings up a thing with big pharma and, they're about medical marijuana, about their resistance to something that, is probably less harmful than alcohol, which is legal. And my argument with that is, why on earth are cigarettes legal and they cause cancer and kill you? And yet that's legal, but we're going to have Jeff Sessions say marijuana is a class the same as heroin. Bull. I just don't believe it. But the thing is that, they try to prevent. They don't want you to have access to these natural remedies. One of the things I just recently came across in my migraine support group was something called Crampton. Crampton, is that correct? Somebody said they used it for migraines. I'm like, what is that? And from researching it, it's used for addiction, and people are having.
You mean kratom? Are you talking about kratom?
Yeah, I'm probably pronouncing it wrong.
And it's also
yes, yeah, I heard that. Some people are, but they're trying to outlaw it. The government is hell bent on.
There are people dying from it. It creates delusional behavior for some people. It could be a harm reduction, and for other people, it's deadly.
Well, Beverly's exactly right. The situation is that it isn't regulated. No one knows what you're actually getting in a capsule or in a package that you pick up at 7-Eleven in some states. In Thailand, it's completely outlawed.
And yet, though, have there been some positive results with this plant? It's a plant, right? Yes, okay.
Great results from it.
So maybe under like a controlled situation, it could be an option, but yet Big Pharma doesn't want that to be an option because they're involved. Exactly, because of profits.
There are lots of families who don't want it to be an option because their kids have either died under its influence or gotten very, very ill. Their addiction has really progressed. So it's a complicated topic.
Yeah,
it's a complicated. I mean, kids. There's been a great increase in addiction since marijuana became legal. These are such complicated topics.
Is that true though? Because marijuana is only legal in Colorado.
Yes, it is.
I've read studies though that it's not.
Many more people and young people are going to Marijuana Anonymous and AA. We have families coming on all the time and getting help from our coaches because their kids are having psychotic breaks. What is it? Marijuana. Kids are showing up in treatment centers. It's all marijuana.
But is this the legal one or is this the street stuff that's being laced with all sorts of stuff? Is this legal marijuana? I mean, that's a point here. Right now, your marijuana is
legal marijuana.
Right, but I've read studies in Colorado that that's not true. That it's not increasing addiction.
Right.
But the problem is that teenagers
there
are
are
going to do
studies
marijuana.
on every side.
Right, like teenagers are going to do marijuana, and if they're getting it from the street and there's some fentanyl in there, it's going to kill them. And this is the problem. They're going to do it anyway, just like they're going to drink anyway, just when we did prohibition and we outlawed alcohol.
And
so the point is, why not make it safe?
Look at all the drugs coming in from foreign countries, China.
Yes.
We just had a major flakka epidemic in Broward County with multiple overdose deaths. And all they have to do is change one or two molecules and it becomes legal. So this seems to be a global challenge, and it's getting worse as far as I can tell.
There's an interesting movie that came out recently, Do No Harm, by David Weiland, the Hollywood producer, and it's all about the influence of Big Pharma and addresses all these issues we're discussing. Might be useful to see it. It'll be on PBS soon.
We should definitely check that out. So Dr. Sunny, weighing in on all of this?
Yes. I just think I have to strongly agree with Dale when it comes to always blaming something else for a problem that arises versus having preventions before it taking place. And I think, like we mentioned, balance does matter. So it's about joining with other colleagues, whether they're in a different field, to find solutions instead of going against things. Because as we mentioned, there are certain medication that certain individuals do need, whether it's for mental health or physical health. So I think the key component is going to be balance and knowledge.
Very good. Yeah, it's absolutely true. It is.
Yeah.
It is balanced, and the bottom line is something Robert brought up in the beginning of our session here, our show, is about how the people are using any substance for pain relief, like emotional. The bottom line is everybody who is an addict is trying to numb some sort of pain.
Absolutely.
So they're going to do, even if you outlawed everything, they'll go drink mouthwash. They'll find something to, they'll take cold pills, they'll do anything. So I think we miss that. I think the root cause is emotional pain. People are in emotional or physical pain. If they're in physical pain, they'll do anything to get out of it. Like Tony Robbins always said, it's either you're moving toward pain or pleasure, which is worse. So if you're in a lot of pain, you're going to, when you're in excruciating pain, you're going to take anything. If you're emotional pain, you want to numb it. So I don't think we address that, that deep-rooted pain that, what are your thoughts, Robert?
Well, I think today most treatment programs are focused on the dependence factor of addiction. They're in a 21-day or a 30-day model, people go into treatment and they're coming out with the dependency handled, but they've done nothing for the long-term sobriety. And there's a difference. Many people become dependent on medication, but they're not addicted to it psychologically. And that needs to be understood. And I don't think the public actually understands that. But as I said earlier, and I think Dr. Sunny agrees, the root of every single addiction on this planet is the word pain. It's the pain of not being accepted, or being the fat kid, or being outsourced, or being left behind. And people are people. We grab for drugs, or we grab for alcohol, or we grab for online sex, or we grab for shopping or gambling, or whatever it is that will make us feel as good as other people. And unfortunately, what we're grabbing is what kills us.
Wow, that's really powerful. Beverly?
Yeah, I think this idea of balance is important. At the same time, it's very important to lay responsibility for this opioid epidemic where it belongs. Pharmaceutical industry created it. Let's face that, okay? Let's face that difficult fact. Yes, people will find whatever, They created it for the purposes of making money. Now that we're turning away from it, they're taking it international so that they can spread it everywhere. I'm not going for a boogeyman. It's just the research on what is truly happening with the opioid epidemic. My company is extremely solution focused. We're not focusing on the pharmaceutical industry at all, except to educate about their role. But we're really about families learning how to have a loving approach. Mindfulness is extremely important. Right relationship is very important. Choosing your words carefully. Dealing with flooding. So the situation.
Yeah, I'm going to pipe that. Yeah, I think I agree with a lot of what Beverly says, but we do have to focus on one word, and that is responsibility. Clearly, I don't know of anyone that went to a physician and with a backache that said, "Well, my goal today is to become an addict." We can only lay so much at the feet of pharma. Now, should they be responsible for contributing towards the treatment of the 26 million people in this country that are needing treatment today? Why not? The tobacco industry is certainly contributing their part as punitive damages. But the reality is that we have to help these clients and help ourselves realize that we are not victims get past the victim role
Right.
and move
Agreed.
forward. Just think outside of the addiction box. And there's a life waiting. That has to happen.
I think the dispensing component has to be addressed as well. Of course, Big Pharma developed and sent the drugs out to be utilized. But for instance, I went to the dentist 2 weeks ago to have a tooth pulled, and the dentist gave me a prescription for 10 days of OxyContin, which I didn't need and which I didn't want. And I think there's a lot of physicians and a lot of people in the dental world that just prescribe these drugs like they're candy, because they don't want to hear their patient complaining of any pain whatsoever. So they just automatically give them a prescription at the conclusion of treatment. And I think education needs to be addressed in the medical schools and the dental schools right from the get-go. And this has to be carried on through their practice.
I love your
Christina,
cat.
I was just going to say, my cat, I was trying to push him down, has joined the meeting. Yeah, he will not go away. He's decided he wants to be on camera and have a say. But that's very true, Dale.
Absolutely. I know I have to leave pretty soon. I have a client, but I was just going to mention, Robert, I love the fact that you mentioned what a cutie pie. I have to mention that, the victim role, that is such an easy, comfortable role to play in, and constantly use excuses and blames, or even utilize the part of, relapse is part of recovery, and all this, excuse my French, BS that sometimes, we hear from our clients, or overall even family members we use because our loved one relapsed. But it's also, the pharmaceutical field has a responsibility. They need to, have cells, but it's also, as you mentioned, Dale, the distributors. Like, how are we distributing things? Like, take responsibility, have knowledge, information, and figure out what is for what. And I think it all comes down to is us having more knowledge. And it doesn't matter if you're a mental health doctor or a dentist or a physician or a PT, like everyone needs to have that knowledge, because there are dentists who are very cautious what they prescribe because they already know the epidemic. But I think just having that balance across the board is going to be very significant. We can always blame others, but it does come down to taking responsibility. There's McDonald's everywhere. Anyone can be obese, but that's a choice as well. Can I eat McDonald's every day, or can I choose Whole Foods or something even from Publix? So I think at the end of the day, we can point all the fingers, but it does come down to the person's individuality, the self-esteem, self-confidence, self-awareness, and the support system. And if they come from a dysfunctional family, there's still support out there. There's sober meetings out there that help people, but you can also get high in those meetings. So again, at the end of the day, it comes from what type of foundation and program of recovery do you want as an individual and need? Because sometimes you may need something but not want it. And a lot of times individuals go after what they want versus need, unfortunately, even though the program of recovery usually says you need it instead of want. But we're human beings, and obviously we're rebellious.
And also, Dr. Singh, just to chime in here, because their eating disorders are a form of addiction as well. Just so everybody knows that too. That there's people who it's just as much of addiction as a drug addiction. Have to go for treatment for that as well. So I want to just end off with everyone just giving their contact information, because it's really important. I know people are going to watch this, going to replay of this, and they're going to want to know how to contact you each individually. So Dr. Sunny, I know you have to run, so let's let you give your website, your phone number, whatever you're comfortable in giving.
Yeah, absolutely. My website is CarrolGablesCounselingCenter.com. What I can do is I can also, text message information. So I'm also on LinkedIn, just under Dr. Sunny Kachaturian. They're more than welcome to reach me, and also on Psychology Today.
Excellent. Thank you so much. And Beverly?
I'm sorry, it's CarrolGablesCounseling.com.
Coral Gables Council, and put it in the comments of the video too.
I will. I'll do it right now.
Thank you. Great.
You're welcome.
Thank you.
Beverly Buncher is my name, and it's bBuncher@FamilyRecoveryResources.com. My website is FamilyRecoveryResources.com, and phone number 188-998 BALM, Be a Loving Mirror. That would be 2256.
Thank you so much, Beverly. And Dale?
Hello, again, my name is Dale Redlich, and my website is pay2patient.com, and my phone number is 954-592-1921.
Thank you, Dale.
Thank
And
you.
Robert?
Hi, I'm Rob, R-O-B, Cantrell, and you can follow my blog, which is read in 47 countries right now. It's robcantrellblog.com. My cell phone number is 323-533-6993. And I would love to talk to anyone that needs help, so please call.
Well, thank you all. You are all been fabulous guests. This has been fantastic. It's been an amazing show. I think we brought up some really good topics that people, really need to know and think about. So if you're watching this and you need help, please contact any of our panelists. They're all here to help you. And our goal of this show is to, give you as much information and as much really good resources. We only put the best of the addiction field on the show. So, if you're watching it, these are the good guys. So you have nothing to worry about. So definitely reach out to them, and we'll see you on the next show. And I want to thank you all again. Thank you guys so much.
Thank you.
Thank you,
Bye-bye.
Christina.
Have a great one.
Thank you. Bye-bye.